Welcome, ladies and gentlemen, to the Heartland Daily Podcast, where today we're going to focus on healthcare, an issue that is always in the news, but not in a very illuminating way. My name is AnneMarie Schieber, and I am the managing editor of Healthcare News, a newspaper, actually, but you can find our articles online. And we mail this newspaper to every elected federal and state legislator, both parties, to present healthcare news from a free market perspective. Now, as I mentioned earlier, healthcare is always popping up in the news, but often when you read these articles, you get very little analysis about why a particular healthcare issue is in the news. Usually it's about a complaint about healthcare, and there's usually a big gap as to what led to this problem. So let me give you an example. Early in the year, Mary Lou Retton, the Olympian, made news because she was in the ICU. And she was with a life threatening illness, pneumonia, and she had no health insurance. Her story gained national attention because her daughters went on a crowdfunding website to raise money for her care. Now, this was outstanding because Mary Lou Retton is not someone you think who is impoverished. She probably made millions of dollars in endorsements, and she was married to a professional football player. The media covered all of this, but nobody explained why she was caught without health insurance. Now, after she got out of the hospital, she did an interview on NBC and she told them, I couldn't afford it. And that was it. To my knowledge, there were no media reports, even the Today Show interview asking about Obamacare. Now, I can only speculate about Mary Lou Retton, who was probably in the individual market and was reasonably healthy. And she didn't want to shuck out 25 grand a year for health insurance. And I'm not including the $8,000 a year deductible. In healthcare news, we had an agent do the write up on her, and that's the price that we came up with. So, what happens to people like Mary Lou Retton is they end up winging it if they're somewhat healthy. And, nobody plans to ring up a $500,000 bill in the ICU, but it can happen. And so that, ladies and gentlemen, is why we publish healthcare news, so we can explain what the culprit is. Now, I should add, our newspaper is co-published by the Heartland Institute and the Goodman Center for Healthcare Policy Research. And that is a good jumping point for me to introduce my sidekick, Devon Herrick. Devon is a healthcare economist who posts blogs on the Goodman Center's healthcare blog, and he writes really good stuff. And we're frequently going to be discussing his posts and articles in healthcare news. Welcome, Devon. It's great to have you joining us today.
Well, thanks.
So this situation happened months ago. A lot has happened since then, not the least of which was an election. Uh, Trump had a sweeping victory. The Republicans now control the House, not by much, and the Senate. The Supreme Court still has a conservative majority in which they made huge decisions this year impacting the deep state. But I want to get back to Obamacare. Now, with all these planets aligned, do you think this is the time that we might possibly repeal and replace Obamacare?
I think Obamacare has so destroyed the market for health insurance. I really don't think there's any way that Congress will be able to repeal it and replace it with, risk-rated plans like we had, a dozen years ago or more. I suspect that what will happen will be that Republicans will tinker around the edges, with the support of President Trump, and little things like maybe beefing up the No Surprises Act to stop surprise medical bills, maybe beefing up the executive order that hospitals have to, give prices, which
Right.
still doesn't work very well, but it would be great if they would.
Right, right. They're kind of meaningless to most people if they have somebody else paying the bills. But there are some people who pay out of pocket. We have a lot of Canadians who come into our country and pay out of pocket because they don't like the long waits in socialized healthcare in Canada. So they're cognizant of the prices, but those prices, the price transparency is all a really good thing, but we don't have a natural free market in healthcare. So it's kind of meaningless. We did an article on this and we reached out to a couple of people about whether they think this is the time for repealing and replacing Obamacare. We tried this in 2017 and we got some movement on it in the House. And then the Senate lost by 2 or 3 votes, I think it was. McCain voted against it.
Yeah.
I forget, maybe two others, the senator from Maine and Alaska. But in any case, we got nowhere on it and they kind of tampered around the edges. Trump did a lot of really good things. He expanded association health plans, which would have been an alternative to healthcare and help people who are not getting employer insurance or wanting to go on the healthcare exchanges. We also had an expansion of short term plans,
Mhm.
which I want to talk about because Biden has just eviscerated those plans. I use short term plans, I think they're great. They are an alternative to Obamacare. You can get them fairly cheaply and you can get large deductibles, but they're plans that really are there to protect a rare catastrophic event, kind of like
Mhm.
indemnity plans that we used to have, that you used to be able to buy in healthcare insurance. And that is no longer. You mentioned earlier risk rated policies. You think they're dinosaurs? We'll never see those again, huh?
Well, I hopefully, of course, as you mentioned, the Biden administration tried to eradicate short-term plans, and I'm fairly confident that President Trump will bring them back. And it's important. It's competition for the Obamacare plans. I mean, you're in a short-term plan. I'm in an Obamacare plan, and it's gosh, like 8,500 a year with an 8,000, 9,000 deductible. I mean, I can't afford to go to the doctor because it's the first $9,000 is out of my pocket, and this is after I've spent 8,500 toward the plan. And if you think about it, that really is little more than a healthy tax or a tax on health. It's like I have to pay a lot more than my expected risk
Mhm.
simply so that others can maybe get a better deal. Well, it destroyed the market. So we really do need more competition in the form of short term health plans.
Well, what ends up happening is we pay for other people's health care, is essentially what it is. I've heard actually a description of it, I think, is so apt, which is what we really have in this country is socialized medicine,
Mhm.
but done through private healthcare plans. And, in the employer market, Obamacare has changed everything so radically. It went into effect in 2014 and now it's this behemoth. I mean, it just seems like it's unmovable. So you're, probably correct in thinking we're only going to hit around the edges. I want to go back to the short-term plans because the Cato Institute did a really interesting panel discussion on this a couple of months ago. I don't know if we've got that screen. So that Michael Cannon there, who's on the left, he invited two other people, and the person in the middle was kind of defending what Biden did. And let me kind of explain what Biden did. And I know these plans so well because I use them. But he used to he pulled the opportunity to use these plans so that they're almost useless. So when
Yeah.
Trump, they always existed. Obama did this too with short-term plans. But what they are is you buy short-term plans. They are short-term plans. You buy them for periods of 6 months or a year, or whatever. People would use them if they were in between jobs. And if you got sick within that short time, you would have, and your insurance expires, you would have to underwrite, get new insurance. And if you got sick, it would be impossible to get new insurance because you would then have a pre existing condition. So you would be without health care until you could jump onto an Obamacare plan. And, there's only one chance in the year where you could do that. So you could be caught for months on end
Mhm.
without insurance. And what Trump did was he allowed the renewability of these
Mhm.
plans up to 3 years. It gave a lot of protection. And Obama reduced the durability and the renewability. And then Trump came in and he expanded both of those. And it's really up to the states. I think my state, you can only buy a plan no longer than 6 months, but some states you could buy them up to a year.
Mhm.
And so Trump came in and changed that. Biden just basically blew it all down to 4 months. That's it.
Mhm.
So you could potentially go for 8 months of the year. And if you're in a really catastrophic situation, you could be like Mary Lou Retton and be without health care coverage and run up a $500,000 bill. It's very frightening. One of the things in this discussion with Cato was Michael Cannon suggested this, that we could have a dual track kind of
Mhm.
healthcare system. So, that picture, if we can go back to it, of Cato, I wish I could remember her name. I think her last name is Murphy, but she was kind of defensive about the Biden changes. And she suggested, and this is no secret, Biden wanted to push everybody into an Obamacare plan. If
Mhm.
you could make the short-term plans so awful, you would force them into an Obamacare plan eventually. And so that's no secret. And what Cannon suggested is, he brought up the case of Germany, which has kind of a dual track system where you could have these healthcare plans that work outside of Obamacare. And, people would know that they don't function like Obamacare plans. That's always what they call them, junk insurance, because they don't function like Obamacare plans. But again, they're a lot cheaper, and probably, you don't have to over purchase insurance. I know Goodman talks about that. He says
Mhm.
the biggest problem is, and maybe you can tell us a little bit about that. People are either overinsured or underinsured.
Well, the whole what you'll hear from the Biden administration is that junk insurance is insurance that doesn't force everyone to have the same suite of benefits, the same mandated, drugs, the same mandated coverage. But maybe you don't want that. I mean, we don't have to all have the same car, the same house, the same anything. And really, that is just a method of forcing everyone to buy what the advocates think everyone needs. Well, you may not need that. I may not need that. I may not want that. I forget now. Years ago, they used to say there were more than 2,000 mandated benefits in health plans if you take all the states together. Well, it's what we talk about in terms of a free market is let me pick and choose which benefits I want. Let me have a higher deductible. Maybe let me forego drug coverage. Um, I could even see a health plan where, it was always said, well, if they all have to have maternity coverage, well, I'm male. So even that is something of a mandate on me. I have to pay extra so that, those that can bear children, have a lower premium. And back when we had risk rated health insurance, people forget that we had a high risk pool, and we also had guaranteed renewability. As
Mm.
long as you had coverage, you were guaranteed the right to renew that coverage. And the whole point was make people stay in the market. If
Yeah.
you want to be covered, you need to stay in the market. Well, Obamacare tried to do that with a mandate and then mandating costly benefits. And what was the result? The result was that nobody could afford Obamacare except those who get a generous subsidy. Well, that doesn't make health insurance more affordable. It just voices more of the cost on the taxpayers.
Right, right. Well, this kind of dovetails into the next topic I want to talk about, because we're probably going to be talking about Obamacare every single time. It's just such a monster that we can't seem to work around. You wrote something real interesting about people's utilization of health insurance. And you talked about seniors in particular, who most are covered by Medicare, but I kind of think this applies to people with employer insurance or even expensive Obamacare plans that aren't
Mhm.
subsidized, when you pay all that money, you're going to be darn sure you use the plan. And so that drives up utilization, drives up demand. It makes long lines to get in to see a doctor. It drives up prices. And so, that's a whole different topic. But tell us a little bit about this blog post that you wrote, because I thought it was real interesting. It's not just, to get good value out of your plan. Medicare, you do pay a little, but it's not like what you pay for Obamacare plans. But tell us what you wrote here.
Well, it started out as a New York Times article saying it is a pain to go to the doctor. And it is a pain to go to the doctor. I mean, it can take up to 3 hours out of your day when you include, travel time, waiting in the waiting room, and so on. And what it turns out that, like the New York Times interviewed one patient who said, every body part has its own doctor. I mean, if you have a podiatrist for feet, the cardiologist, you have OBGYN, everything, and it can be a major pain. Well, what we found out was that seniors, I mean, of course, they're older, health declines with age.
Mm-hmm.
And so something like a substantial number of seniors see the doctor at least once a month, sometimes like 25 times a year. Well, a small percentage of seniors see the doctor about 50 times per year.
Oh
Well,
my
that's a
goodness.
lot of time out of your day, out of your
Yeah.
week.
Yeah, and some of them, I don't know if it was in this New York Times article, but maybe another source that suggested this is kind of a social system
Mhm.
where
Yeah,
seniors, high retiree states like Florida, meet their friends, and it's kind of a fun thing to do to go to the doctor.
well, yeah, there's been past research going back years that have found that if you look at states with a high concentration of retirees, that they have a higher utilization of physician services. And an article that I read, I forget, like 5, 6, 7, 8 years ago, said that in Florida, especially, that you go to the doctor, you meet people just like you talk to them because you're stuck there in the waiting room. And it was pretty common to compare doctors and, let me give me his number. What's his name again? And pretty soon you're sharing who your doctors are, you're sharing who you like, and the people you didn't know before you went to that visit are now calling that doctor. And it becomes, it's hard to think of it as a social activity, but it kind of is in some cases.
Well, and it drives up Medicare costs. I mean, think about it. And this gets back to employer plans and the ones that you're paying a lot of money. Employees think they have free health care, but it's actually a big chunk of their compensation that their employer gets to choose how you spend it, right?
Mhm.
Those employer plans are pretty pricey. If anyone's ever priced out a COBRA plan and you see what you're stuck with the bill. Um, you know, to me, it seems like the healthcare plans want to rope you in somehow to upcharge you some way. So to me, I can't understand. Mentioned earlier, I get short-term insurance, but I get phenomenal primary care through direct primary care, which I pay out of
Mhm.
pocket, $90 a month. And I can see my doctor like within 24 hours, talk to him almost, it's amazing how it works. And I get phenomenal care. I see my doctor for like an hour each time. And you think, how could anybody run a practice like this? Well, few people need to go in because they take care of people at the get
Mhm.
go.
Yeah.
They listen to their problems. They're not shoved down in 15 minutes. And so the care is a lot better. And when you got healthcare plans that are taking all the primary care up, you got to go through their regulators and their
Yeah.
pre authorizations. Then they'll probably send you to other providers, which drives up more utilization. If
Mhm.
you get a good internist, you don't need to go to maybe a podiatrist to fix a simple foot problem. It just
Oh,
finds more
absolutely.
problems, right, to fix.
And you apparently your doctor that you're going to, that's a great deal. I mean, 90 a month. I was looking at one near my house that charges, I think, 80, and I haven't done it yet, but I've been considering it very seriously because this year, my Obamacare plan was actually through a local hospital system, which was my former employer.
Mm.
And I was looking for a doctor because I mean, I have to change doctors sometimes and you get a new health plan. They all worked for that hospital system. And I've literally not gone to the doctor because I'm afraid that
You
the
think
hospital employed physician will send me to the hospital owned facilities. And that's the highest price place you can go. And I
yeah,
would much rather have an independent doctor that would work with me and say, no, you can let's look for a cash based, whatever, test. It's, I mean, can you imagine getting blood tests at a hospital just because your doctor works for a hospital and that hospital wants to capture all referrals?
yeah,
It's kind of
right.
scary.
Well, I'll tell you, that is just something that's getting more and more attention. And, we've had some horrible things happen, not the least of which is this assassination of this CEO from United Healthcare. To me, it's everyone tried to excuse the behavior and used it as a launching pad to go after healthcare. I think it's a little more complicated than that, but
Mhm.
I think it is bringing up the rage over healthcare, certainly, and this issue is not going to go away. So we need to come up with a better solution. You also wrote about something related to seniors in terms of long-term care. Now, for our listeners, as you know, healthcare does not cover long-term care, which is a whole nother rabbit hole.
Mhm.
Very expensive. People do not typically carry long-term care insurance because it's
Well,
hard to find, very expensive. So they find other ways around this. But tell us a little bit about what you wrote, and we'll get to these studies here in a moment. But tell us a little bit about this social medicine and how people work in groups for this.
well, there's been a lot written about long-term care and the needs of solo seniors, which is most seniors, if you think about it. I mean, men die, women outlive their husbands, and in many cases, they're living alone. Well, what do they do? They have to turn to friends and family and informal networks of, of, of friends or neighbors for care needs in some cases. And so, yeah, and I even joked with you about, my Golden Girls solution, which I've told this to other people, and like you, they always say, "Well, that doesn't work in real life. That only works on TV."
Yeah,
But
they
it
all
all came about because of a New York Times article from a few years ago. Did the math and said, if three people lived together and had paid for round the clock home care, it would be cheaper than a nursing home.
Oh yeah,
Well, okay.
yeah,
And so my Golden Girls, joke is really about if you don't have a big pension plan, if your Social Security isn't huge, in some cases it might make more sense for three unrelated individuals to live together and pay for those services that they need that they can't do for themselves. It'd be a lot cheaper than a nursing home. Of
yeah,
course, the devil's in the details, which is, well, how do you arrange that? Who facilitates that? If a nursing home facilitates that, they would call it assisted living, and they would want a huge chunk of the savings. Um, it's really just what can we do to make it easier for people as they age to be able to remain in their own homes. I mean, and that's one of the methods.
well, I want to get to that part about paying for long-term care in a minute because we got a response from one state in this last election that's kind of alarming, very strange. But I want to make a couple more points while we're on this topic. In your blog post, you mentioned that 70% of those over 65 will require long-term care
Mhm.
at some point. The cost of care is about 100K per year,
Mhm.
and assisted
Or
living
more.
like 70K. So that would be full care. Women outlive their husbands. The unreality of Golden Girls, because that just only exists on TV. And, the other issue is something that came out recently that the Paragon Health Institute brought up in a report. So, in the last couple of years, they came out with these reports: long-term healthcare, the problem, and long-term healthcare, the solution. And it's an excellent report that's very user friendly if you want to read it. But here's what's going on in long term healthcare: we have an incentive not to save for long term healthcare. First of all, we
Mhm.
have very restricted health savings accounts, we can't use those. And what happens is we make it super, super easy for people to qualify for long term care coverage under Medicaid. And people figure this out. There's a whole industry, usually of attorneys, who help you figure out how to structure your assets so you can qualify. And so, again, this gets to the institutionalization of long term care, because they just don't give you Medicare paid, doesn't give you a chunk of
Mhm.
change and say, hire somebody to come to your home. No, you end up in a nursing home. And so, these articles, these reports talk about why Congress really needs to get this right, because we are going to have an explosion of this stuff going on with
Mhm.
baby boomers now getting into the 80s, requiring possible long term care. But to me, it's amazing, in these reports, you'll hear outrageous stories of people with like millions of dollars in assets and are on Medicaid for long term care.
Mhm.
And it's, of course, bankrupting that program, which was intended to be the safety net for impoverished people. And we're covering everybody under Medicaid now. So it's become a safety hammock. um, Last topic, which is related to long term care, which is in Washington state. And you did some math for us. So, Devon, can you kind of tell us what happened in Washington state, what they did?
Well, someone had this crazy idea that everyone who has a job should pay a payroll tax and in return get a long-term care benefit that maxes out at no more than 36,500. And I've done the math, and it's 36,500 is not much, but it is a tax. But it's costing what, 500 per year on average, for households. And in a 40-year career, you could actually have a real benefit of $20,000, plus interest, of course. And we can assume that Washington State, the bureaucrats, don't really know anything about running long-term care, because, I mean, if long-term care companies can't even run long-term care and make it work. And so it just, it seems like one of those ideas that makes sense to some people and who haven't thought it through. And when they really look at it, it was almost repealed this year. It's essentially forcing people to save a little bit for long-term care through a state program that will probably bankrupt the state and not do any good. And all the while, it could be going into an HSA.
Right. And, they did some actuary reports on this. And when it first came out, they were giving people the option to, to participate. And what this ballot measure was in November was it made it mandatory. And what these actuary reports found, that if they didn't make it mandatory, the thing would go belly up in a couple of years, because most
Mm-hmm.
people would figure this out and say, no, thank you. And so now the only way they can at least convince themselves that this is a good thing is to force everybody into it. And, again, even though that $36,500 benefit will be adjusted to inflation, you have no idea what's going to happen 10, 20 years down the
Yeah.
road. And you're shucking money out for this tax that you'll never possibly even be able to collect if the program falls apart. So buyer beware, voter beware. We see this stuff all the
Yeah.
time. No, there's no quick fix. So we need to get back to free market healthcare. Well, I think, is there anything you'd like to add before we sign out? We've got so much coming up that we can talk about in the future, but I guess you're pretty excited about the prospects of a totally new administration and how they're going to be cleaning up a bunch of
Mhm.
state stuff, regulation. I think that all looks very promising for healthcare.
Well, I hope they do. For example, I just read about the telemedicine. The waiver will lapse without being extended. Telemedicine is something everyone seems to enjoy or like, at least in theory, whether they use it or not. But it's still a great avenue to be able to talk to a doctor on the phone. Heaven forbid. But I really have high hopes for transparency. And something that everyone agrees, right and left, is the need for site neutral payments. Why should you pay a hospital more than a ambulatory surgery center? You don't pay Home Depot more than you pay any. Yeah, it's competitive. You pick and choose where you want to go. But with Medicare, Medicare automatically gives hospitals more than if you were to look for a better deal. You go to a doctor that's in a hospital network, and sometimes they charge you a facility fee. Hopefully, that will go away with the new regulations. And I'm trying to think the No Surprises Act banned one type of surprise medical bill, but we're running into a lot of other surprise medical bills or bills we didn't expect. Hopefully, the Trump administration will deal with that in the future.
Well, we can only hope. And I tell people, don't get your hopes up too highly because we're dealing with decades of bloat, and people are not going to give up it's been a cash cow for them for many, many years very easily. I don't think the hospitals are going to be walking away quietly if we try to take away those site payments.
Mhm.
So
That's
stay
true.
tuned, folks, and we hope that you'll join us again in the future because we'll have a lot to talk about. Devon, thank you so much for joining us.
Thanks for having me.
And I really look forward to more engaging discussions on healthcare. And thank you, listeners, for sticking around. Please share our link if you found our discussion informative. Until the next time, enjoy the holidays, which are coming up here at the end of the year, and stay well and stay vigilant.